Personally, we did courses like history, peace and conflict, world in modern society, and
Yes. So here today with me, your host, Nathan Yeshua. I have a beautiful guest, a vibrant, young, passionate woman, Raji Adetola. Raji. I really like that name. I don't know. It's boost boost.
carries power.
Yeah, so what's the meaning of Raji?
I just know that it carries power.
So who is Raji Adetola?
She's a registered nurse, a registered public health nurse,
That's a
registered
big
midwife
flex.
in view, and above all things, she also loves fashion. Yeah.
So she's a fashion enthusiast.
Yeah.
So she has a passion for fashion.
Mm.
So we'll just dive into it straight away. Reference to all the challenges that you faced as a student and how it has helped you become the person you are presently.
So I remember before I got into nursing, I used to have anxiety issues. Yeah, like my anxiety, just tell me to come and do something. My heart,
You beaten.
yes, a lot. So I remember in 200 level, where I'm supposed to have an exam. That was in OSCE, traditional OSCE,
Okay.
because that was where we start from before moving to the normal OSCE. I don't know if you get
Yeah, I understand.
Yeah, so that one you set up it, you be the one to set everything up and all of that. So I remember I failed that course, not because I did not have the necessary knowledge, not because I did not practice in my room with my friends, but because I let my anxiety like take the most
Take
part
the
of
most
me. And when I failed, God, I just knew that this anxiety has to
You have
stop.
to work on it.
Yeah, so I feel like nothing helped me in that aspect. So now it has like reduced drastically.
That's
In
a
that
very
experience,
beautiful thing.
that's reduced drastically.
So now, apart from that, in schooling itself, like how difficult was it for you to balance? You said you love fashion. I don't know, where did this passion originate?
Yeah, from my mom, she's a fashion designer, so
Okay.
I love her work. So I don't know, just naturally started, you
Yeah,
know.
induced. I can
yeah.
understand. So how do you now balance other aspects of your life, like the creative part of your life with your schooling, with all the other things you have?
Personally, I'm not really good at joining two things. So I take it one step at a time, one thing after the other. I don't even like try to force myself.
Multitask, okay.
Yes, I'm not good at multitasking. So the first thing you need to know is like just know yourself. Once you know that personally I can't do this, you can learn. You can learn. There are some times that you will be able to do it, but if you know that it's too much for you, just take it one step at a time.
Definitely taking stuff
Yeah.
one step at a time, knowing yourself.
Don't follow the crowd.
The saying that goes, jack of all trades but master of none.
Yeah.
So sometimes it's good to diversify, but as much as you want to diversify, you have to know your ability and work based on your ability so you don't
Exactly.
crash.
Yeah.
That's the very. So how has your general experience with people, schooling, where you grew up, and most importantly your interaction with patients, how has it affected your perspective towards life?
Most importantly, I've come to see life as very, very delicate. I can be talking to somebody now, the next minute, they are no more. So life is just very delicate, and you just enjoy every minute you can enjoy with the next person.
So moving on, we have your experience as a nursing student will have brought you to a lot of people, a lot of situations, a lot of scenarios that you have been able to meet people. So how do you feel your experience as a student has created a network for you? How do you think someone that's stepping into a first year nursing student can build a good network towards opportunities in the future?
I feel like don't just center all your nursing education on just books. Try and get involved, even if it's just okay, maybe sports, or just get involved in something aside books, because that's the best way to just mingle with people. Because imagine book.
Yes,
book.
yes.
Yes.
So during your course of study,
Yeah.
there are many courses that outside the convention of nursing that take you to, like we just said about diversifying. So, what do you think it has been? How do you think it has been impactful to your nursing practice?
Okay. Personally, we did courses like history, peace and conflict, world in modern society, and
Philosophy.
yes, philosophy of logic, philosophy of education, like a lot. That was 200, 300 level. We did like a lot of, other courses that are not even related to nursing book. And then when we want to go for the class, we'll be like,
Do we really
do we
need
really,
it?
yeah, this is not nursing. Do we really need to like go through these courses? But at the end of the day, they impact the way we relate to our patients in the world. Imagine, taking history as a course and going into the world, seeing different people from different races, from different tribes that I'm not your tribe. I'm Yoruba. I'm relating to a patient
Igbo
that is,
person.
yes, that is Hausa, that is Igbo. Like Hausa now, they are very, very good with tolerating pain.
Yeah.
So imagine you not even having any knowledge about other, you're not able to know that, okay, this person is feeling pain and she's just like bearing the pain. I don't know if you get what I'm
I understand
saying.
you.
So one way or the other, no matter how little, those courses, like, they impact the quality of care we give to our
So we understand that the curriculum is built to help you in everything that you need towards your practice, knowledge that you need. So that's a very beautiful point. So apart from that, there's this jackpot season, everybody trying to leave the country and everything. So how do you feel? As of last 3 years, the Register of Nursing and Midwifery Council of Nigeria, there are up to 42,000 nurses have left Nigeria in the last 3 years.
No more.
If not more. That's what the register has. So the brain drain in Nigeria is very drastic. So how else do you think government can entice nurses or healthcare practitioners to stay in the country and help towards?
That's very simple. Like, make them relevant in the profession. Make them feel like they are parts of the healthcare sector. Increase the pay. Make the the working environment favorable for them. Don't make it toxic for them. Don't make them feel inferior to every other healthcare practitioner in the hospital.
That's a
Yes.
very important part.
Yes.
Because
they feel like they're not valued. Why are people traveling? Yes, they feel that
they want to go to places that they are
where they value,
valued.
where they value them. So once they start valuing them more in Nigeria, to
There'll be more
reduce.
change. That's very good. Because typically, you expect that nursing students, nursing practitioners, they are looking for the fastest way to leave the country.
We all want greener pastures. We can't stay stagnant.
So that's very important. Have you seen Alabere, the movie Alabere?
Yeah, it's very enlightening. Kudos.
Kudos to NCI. Creativity is another aspect of what we do. We are typically giving you information that you won't see elsewhere. This is the home of nursing. I'm giving you top-notch content towards what you need to know and things you had no idea about. So the Alabere movie talks about quackery.
Yes, and that's like, it's very, very prominent now.
So go see the movie Alabere. It's a very enlightening movie. So kudos to NCI Nursing Conception Initiative Studio at Obafemi Awolowo University, Osun State. So to conclude this episode, just want to say a big thank you to our guests here, Nurse Raji Adetola. Thank you very much. So what will you have to say to that young child that is watching, or that SS3 student writing their WAEC or preparing for JAMB or about to enter university, so that they know what to expect or how well to prepare towards schooling as a student generally in Nigeria, and particularly as a nursing student?
It's very challenging, but it's something you can do, something you can manage, something you can cope with. It's not beyond control. It's not beyond your control. Something you can eventually, cope with. But it's very challenging, but also fulfilling at the same time. Yeah.
So, giving you out there, listeners, wherever you are in the country, wherever you are, believe in yourself, focus, and you can do anything. Thank you. I'll see you in the next episode.